Being the head of the institution, what makes you proud?
We're very proud that we're the only research institution in the country for infectious and tropical diseases. We have contributed to public health, mainly for control of infectious and tropical diseases, because that's our mandate actually. We want to say that we have contributed to air-eye control, to acute respiratory infections, viral diseases, HIV, tuberculosis. Schistosomiasis is a disease that's endemic in some parts of the country, but of course not everywhere. But we do our research where the disease are found. So schisto, we go to Leyte, we go to Cagayan. We also do malaria research, and we have contributed much to treatment of malaria in the country. There's a lot of other diseases that we deal with. HIV, we have the largest cohort of HIV patients being treated with antiretroviral drugs and being followed up. And other diseases, influenza, dengue, tetanus, meningitis, chikungunya, surveillance, and many more. Since we are the National Reference Lab for Emerging and Re-emerging Infections, that was way back in 2000. Even before that, we were looking at other emerging infections. We started to look at Ebola in 1989, looked at other viruses. But in 2000, we dealt with SARS. And we were very good with SARS diagnosis together with WHO. We were able to diagnose the cases that were had SARS actually, and we are very proud of our laboratory. Laboratories, our molecular biology lab, our special pathogens lab. We responded to outbreaks like H1N1, Ebola in pigs also, aside from Ebola in monkeys, also in MERS. Recently, MERS, that was last year, May, to be April, May, to be specific, and also MERS again this year, and also we're getting ready for Ebola. We want to make sure that we are ready with diagnosis, so there's early containment of the disease. We train our staff. They're very well trained from the hospital, the clinicians, and also the laboratorians. Our laboratory people are very well trained here and abroad. We work with our collaborators from Japan, from NIID, also from CDC, from WHO. They offer a lot of training for us because we are the National Reference Lab for Emerging Infections. They come to help us when there's an outbreak, and we work with them. We work with a lot of experts from these agencies.
We also noticed that the people working in the laboratories are they seem to be very much experts in their field.
They're experts. We hire them based on their credentials. And I like to say that most of them are the cream of the crop in their field. We have molecular biologists. We have laboratorians, medical technologists from all over the country. Eventually, we get to train them as they work here at RITM. They're mentored by our supervisors who are very good also. I mean, experience has taught us the best way to hone these people is to really make them work and work with them. When we were established in 1991, we were established as a research institution. So we started doing research. It's really for public health. We do research for public health, for control and prevention of infectious and tropical diseases in the country. We hope that we can contribute to this to control of these diseases. We hope that our data will get into the Department of Health for the control programs. But we do a lot of advocacy to make them use our data. We publish our data here and abroad in peer-reviewed journals. There's more than 2,000 publications from RITM, and we're very proud that we're very prolific researchers at RITM. The media, they would come when there's an outbreak, when we have a suspect case admitted here. They come in droves. They come with their vans, with their cameras. We tell them that sometimes we're not the spokesperson for the Department of Health, but sometimes when they allow us, we talk to the media. We tell them what is the condition of the patient, as we are allowed to do so, and we're just not allowed to say a lot of things about cases unless the Secretary of Health allows us. I mean, of course, information should go through the proper process. All information will go to the Department of Health first, from the Secretary of Health, because from the Secretary of Health, it goes to the President, because the President has to know whether or not when there's an outbreak in the offing. So we keep our mouth shut until we're ready to face the media. But when they come here and tell them, when there was MERS, suspect MERS case, Ebola case from West Africa, they were waiting outside, and I said, we cannot talk to you because we're not the spokespersons, but I have to clear this with the central office whether or not we can talk to them. We cannot just shoo them away because it will cause more panic, because they might think we're hiding information from the media, and we just needed to allay their fears and then tell them what's the situation, but not give us much information. It's just to tell them that we are ready to manage the cases, we are ready to do the diagnostics, to tell us whether or not the patient is either Ebola or not, or whether the patient has MERS or not. Locally, we are in close coordination with the control program and also our local partners where the diseases are. Internationally, we collaborate with funding agents. That's where we get most of our funding for our research. We compete for research grants. We get a lot of research grants, and that's how we are able to do research at the Institute. We have funding agents like the National Institute for Health. We have CDC for influenza, TMRC for schistosomiasis, IDRC, our just visitor earlier, for schisto and also malaria and dengue. So we have funding agents who come. Sometimes they come to us. They ask us to do research with them. We have had a lot of collaborations for acute respiratory infections. We've done research with our collaborators from University of Colorado, Helsinki, KTL, the National Institute of Public Health in Finland, also with Sanofi, because they produce the vaccine, which we tried in the field the study for over 10 years. Sometimes researches last for years. That's why, people are not very interested in research because the results are very slow. We cannot come up with results as soon as they need the results for a control program. But the results are, it's research, it's science. We have to be very specific. We have to be very exact about the data that we collect. Our researches range from epidemiologic diseases. Epidemiology of diseases, looking at burden of diseases. We also do clinical trials. We also do research and development of biologicals, like diagnostics for schistosomiasis, vaccine development for schistosomiasis. So, and then it's one of the studies of one of our scientists looking at a vaccine for for schistosomiasis control. So it's a whole range of research from the basic research to field implementation. We also, our clinical trials are mostly clinical trials for vaccines and looking at their efficacy for children. I mean, combination vaccines are the in thing now, and pharmaceuticals would come to us to test vaccines for children. When we started in 1981, we were just doing research, service, and training. And over the years, we've continued to do so. We've established track record for research with foreign collaborators. We've established a lot of collaborations, foreign collaborations. And in 2000, we now are doing biologicals. When there was rationalization, the biologicals production service was given to us, and also the national reference laboratories were given to us. So for national reference laboratories, we support all surveillance activities of the Department of Health for like influenza, for dengue, for measles, what other diseases? Chikungunya is included, dengue also, and polio. Because these are diseases for eradication or elimination, so we do. We're also doing surveillance now for rotavirus, because we're just implementing the rotavirus vaccine in the country. And we're looking at vaccine preventable diseases also. Our research activities are really reviewed by our institutional review board. This is internationally recognized. It's FREB accredited and also FERCAP accredited. So we could say FREB, it's Philippine Health Research Ethics Board, and also FERCAP is Forum for Ethics FERCAP, Research Committees in Asia Pacific. So we're very strict about how we do research. We practice good clinical practice. We make sure that our laboratorians, our clinicians and laboratorians have GCP training before they embark on a research activity. We want to be recognized as a center of excellence in infectious and tropical diseases, whether it's diagnostics, whether it's research. We'd like to expand our domain. Actually, we want to be a true partner of the Department of Health in the control of infectious diseases. We want to really contribute to public health in the country. That's our mandate ever since we were here. It's really to do public health, to contribute to control and prevention of infectious and tropical diseases. And we want to be a center of excellence when we do that. Part of our milestones is now we are recognized as a regional training center by WHO, TDR. So we are tasked to do training for GCP, for ethics, for research methods, not only locally, but also for the region, the Western Pacific region. So we've started doing that like 2 years ago, and we have continued this activity together with the WHO. And we're expanding our activities to look at other areas where we can focus on. Now we have expertise in biosafety and biosecurity. That will be one of our programs in that training center.